Hey, Ashley.
Oh,
How are you?
there you are. Sorry, you went away for a second. All right, welcome back to Medication Monday. Yes, I have another medicine I'd like to ask you
Absolutely.
about.
Let's
Um,
get to it.
All right, what can you tell me about Effexor?
Effexor, that's a really good medication. I find it's so helpful for some folks. So Effexor is indicated for depression, for major depression, and it's also indicated for anxiety disorders, namely, I think, generalized anxiety disorder. And it is a type of medication classified as a serotonin norepinephrine reuptake inhibitor, which is a big mouthful. Yeah, so that's its main indication.
So, what happens if you've missed a dose? I've heard of people saying that they'll get brain zaps. What is a brain zap?
Right. That's really, yeah, brain zaps. It's totally weird. So brain zaps or brain shocks are kind of like a hiccup that happens in your head, where folks, if they miss a dose of Effexor, and Effexor usually has a shorter half-life. That's the time it takes for half the medication to get out of one's system. So if that happens too rapidly, it creates a withdrawal phenomenon. And when you have withdrawal from a serotonin norepinephrine reuptake inhibitor, it can make you feel icky. Sometimes folks feel more anxious, or they feel discoordinated or dizzy, or they'll have a brain shock or brain zap, where it's kind of like a brain hiccup. It's not inherently dangerous, but it feels uncomfortable, especially if you don't know what's happening and you're like, what the heck was this, So as a doctor, when I'm prescribing to folks, I have to be really careful of who I present this medication to, because if they're not used to taking something every day and you have to take Effexor daily, its generic name is called venlafaxine. If you're not used to taking something daily, and you imagine like somebody who's 20 years old who has never taken like blood pressure medicine or cholesterol medication, some folks aren't just not a fan of like having to take something daily. I like to tell people everybody ends up taking something daily at some point in their life. I've met a handful of patients here who are like in their 70s who don't take much at all. They don't even take like Advil or Tylenol, which is impressive. But the patient has to be willing to take it daily and be responsible, especially with something like Effexor. Now, with something like Prozac, which is similar to Effexor in some ways, that half-life is super long. So if you miss one dose, a lot of times folks don't notice nearly as much as Effexor.
Okay. All right. When would I be prescribed Effexor? Do I have to try other things first, or?
Yeah, that's a good question. Usually what you're asking is it first line, second line, or third line in like a doctor's mind when presenting it. So if I have a patient who has tried one or two SSRIs, that'd be like Prozac, Lexapro, Zoloft, and they're not doing as well, or if they feel too flat. Sometimes I have folks where they feel flat, less energetic on those meds. Then we'll switch to something like Effexor. And the reason why that is helpful is it has a norepinephrine component. And when you raise norepinephrine in someone's brain, it helps them focus a little bit better. It can help with energy. They kind of feel like it balances out the serotonin component, and it's very helpful. Also, when you raise the dose upwards of like 150 milligrams or greater for Effexor, it kind of turns into a stimulating medication, kind of like an ADHD med. So we sometimes use it off-label for ADHD in folks who can't tolerate your typical meds like Adderall or Ritalin. So it's a versatile medication, and it really gets people feeling better, quicker than not, I think. I will say one thing just about side effects for that one. If anyone's listening, side effects of Effexor can sometimes be lower libido. It can make people jittery. It can make folks have like hot and cold flashes occasionally, or night sweats, possibly like higher blood pressure. So all those things need to be discussed with patients usually if they're taking it. And if a patient notices that, they should tell their doctor and, be examined in case it's going on. But yeah, it's a good medication. Okay, see you next Monday. Bye.